Rapid urbanization and technological innovations continue to increase the health awareness of people across the globe. While there are several herbs claiming to strengthen the human immune system, there is no magic remedy to safeguard the human body from the hundreds and thousands of medical conditions that threaten its health and well being every day. While there is no tested way to guard ourselves permanently from the most debilitating infections and chronic disease conditions, the adoption of a healthy lifestyle based on routine physical activity and a nutritious diet is the best approach to increase the disease fighting ability of the immune system. Evidence-based scientific literature advocates the health advantages of several potential herbs containing minerals, vitamins, bioactive compounds, phytochemicals, polyphenols, and antioxidants. Since the increased consumption of highly processed food items leads to a nutritional deficit, the transition to a healthy dietary routine is the first step to improving our body's immune responses. Furthermore, we need to customize our dietary habits by including some of the most immunity enhancing herbs and spices based on their immune modifying potential. A thorough understanding of the constituents of these plant derivatives is vital to using them for the overall health benefit of the human body. The regular intake of these herbs could also assist in minimizing the risk of nutritional deficiencies and fatal diseases based on their anti-mutagenic, wound healing, and anti-inflammatory properties. This video will walk you through a powerful herb known as cinnamon, whose regular usage could help you improve your immune responses and overall disease fighting ability. Cinnamon has been used for at least 4,800 years. It was originally called kwai in Chinese. The Bible mentions that cinnamon was a part of anointing oil used by Moses. The Romans used cinnamon for its medicinal properties to treat digestive and respiratory problems. They also used it in funerals to mask the smell of dead bodies. In Egypt, cinnamon was used to embalm mummies and to add flavor and fragrance to food. Cinnamon has been shown to regulate blood sugar levels in small randomized controlled trials, but the results have been mixed. A meta-analysis of 10 randomized controlled trials with 543 patients found that taking cinnamon in a dose of 120 milligrams per day to 6 grams per day for about 4 months led to a statistically significant decrease in fasting plasma glucose levels and an improvement in lipid profile. The cinnamaldehyde compound in cinnamon gives it its antimicrobial properties. It can stop the growth of listeria and Escherichia coli in food, which extends the shelf life of food. Cinnamon oil has antimicrobial activity in the range of 10 to 150 micrograms per ml. The methanol extract of cinnamon has the greatest antioxidant activity in comparison to ethanol and water extracts. Eugenol, a component of cinnamon, has antioxidant properties that prevent nitration and lipid damage caused by peroxynitrite in laboratory models. This effect of eugenol can also help treat liver problems. Water extract from cinnamon has an anti-inflammatory effect in laboratory tests, which is due to its potential to reduce the levels of tumor necrosis factor alpha and interleukin 6. Cinnamon contains phytochemicals that boost the brain's ability to use glucose and improve insulin resistance. This is an important mechanism by which cinnamon may limit Alzheimer's induced changes in the brain and regulate brain insulin signaling. Reviews from 3 studies have shown that cinnamon can lower both systolic and diastolic blood pressure, but how it does this is still not fully understood. Another study with 59 participants found that adding cinnamon to the diet can significantly reduce systolic blood pressure. The main reason for this effect is thought to be the production of nitric oxide, which relaxes blood vessels. However, an animal study suggested that cinnamon can also affect KATP channels or the ATP sensitive potassium channels in the vascular smooth muscles, which also lowers blood pressure. Findings from a preclinical study indicated that cinnamon in mice improved their lipid profile by reducing their high-density lipoprotein or HDL cholesterol plasma triglyceride levels. Another study found that rats given cinnamon cassia powder for 35 days had lower levels of total cholesterol, triglycerides, and low-density lipoprotein or LDL. Additionally, cinnamon's oils lowered cholesterol levels in broiler chickens. A recent study found that humans who consumed 1, 3, or 6 grams of cinnamon per day had lower levels of serum glucose, triglycerides, total cholesterol, and LDL cholesterol. The beneficial compounds in cinnamon, such as cinnamaldehyde and cinnamic acid, may contribute to heart health by generating nitric oxide and reducing inflammation. Additionally, cinnamaldehyde helps relax blood vessels by blocking L-type calcium channels. Cinnamon's effect on melanoma cells has been extensively studied. It has been shown to block the activity of factors that promote blood vessel formation, which is essential for tumor growth, and to increase the activity of cancer-killing CD8 plus T cells. The extract of cinnamon contains polyphenols, which are powerful inhibitors of vascular endothelial growth factor, which is a key factor involved in the proliferation and migration of endothelial cells during blood vessel formation. Simply combine 1 cup of hot water with 1 cinnamon stick in a small saucepan. Bring to a boil, then let the mixture simmer for 15 minutes. Remove the remains of the stick, then pour the tea through a strainer to catch any large chunks of cinnamon. Drink hot and add lemon, milk, or cream as desired. If you're making a curry or a sweeter Persian rice dish with raisins or dried cherries, you can add a cinnamon stick to your pot of rice for a warm, woody flavor. To make cinnamon almonds, simply toss almonds with cinnamon and a small amount of oil. Bake at 250 degrees Fahrenheit for 10 to 15 minutes or until golden brown. Cinnamon is a delicious and healthy way to add flavor to your breakfast toast or to bake a loaf of cinnamon bread. Sweet corn cinnamon soup is a delicious and healthy soup that is perfect for a winter meal. If you're trying to cut down on your sugar intake, you can use cinnamon as an alternative to honey and sweeteners. A sprinkling of cinnamon in a mug of coffee contains less than 1 calorie, while a teaspoon of honey has around 20 calories. Cassia cinnamon, the most common type of cinnamon, contains high levels of coumarins. Coumarins are compounds that can decrease the density of the blood. In high doses, coumarins can be toxic and can interact with blood thinners such as warfarin. However, the results of studies on the effects of coumarins on blood coagulation are contradictory. Coumarin is also a toxin that can damage the liver. Food products are not allowed to contain coumarin, but because many people are not aware of this, patients with liver disorders should avoid using cinnamon in their diets.